All right, today we're going to dive into something that affects the very act of breathing for millions and millions of people all over the world. We're talking about chronic obstructive pulmonary disease, or as you've probably heard it called, COPD.
You know that feeling? When you take a deep breath in, but then you just can't seem to get all the air back out? It's this weird, kind of powerful sensation of being, well, stuck.
Well, for a whole lot of folks, that's not just some random feeling. It's their daily reality. It's a progressive disease called COPD. And the tricky thing is, it creeps up on you, developing super slowly over years. A lot of the time, by the time the symptoms are really noticeable, the disease is already pretty far along.
So, what is this thing really? Well, at its heart, COPD isn't just one disease. It's a whole group of lung issues that all share one major problem. They make it really, really hard to breathe out. Your airways get narrower, and the little air sacs in your lungs, they lose their bounce, their natural springiness. And that makes exhaling a real struggle.
Okay, to get a handle on this, we've got to take a peek inside the lungs. Let's see what's actually happening on a mechanical level.
So, COPD is kind of like an umbrella term, and underneath it you've got two main culprits. First, on the left, you have emphysema. This is where those tiny air sacs, the alveoli, get damaged. They lose that elastic recoil we talked about, that springiness, so they can't push air out effectively. Then, on the right, you've got chronic bronchitis. This one's all about inflammation. The airways swell up and start pumping out this thick, gunky mucus that just clogs everything up. And, a lot of people actually have a mix of both going on.
And when you put those two problems together, what do you get? Something called air trapping. It's exactly what it sounds like. It doesn't matter if the airways are blocked or if the air sacs are just too weak to do their job. Either way, old, stale air gets trapped inside the lungs. And of course, that makes it almost impossible to get a good, fresh breath of air in.
Okay, this is a really important takeaway. If you're going to remember just one thing about how this works, make it this. Restrictive lung diseases mean you have trouble getting air in. But obstructive diseases, like our friend COPD, mean you have trouble getting air out. It's a simple distinction, but it's absolutely crucial. So that naturally brings up the next big question, right? How does this even happen? What's causing all this damage to begin with? Let's dive into the causes and risk factors.
And here it is, plain and simple. While there are a few other things that can contribute, smoking it's the big one. There's just no question about it. It is the #1 cause, the primary driver of the damage that leads to COPD. You can also see things like pollution and even genetics playing a part, but smoking is definitely the main event.
But hold on, it's not just about smoking cigarettes yourself. The list of risks is actually pretty broad. Vaping, or e-cigarettes, have been linked to it. Secondhand smoke is a big one too. And get this, scientists are even looking into third-hand smoke, which is the nasty residue that gets left behind on clothes and furniture. On top of all that, you've got things like industrial dusts and chemicals, and even a rare genetic condition that can put you at risk.
Okay, so we've covered what's happening inside the lungs and what's causing it. Now let's bring this into the real world. What does this actually feel like for someone? What are the signs, and what kind of complications can pop up down the road?
Well, it usually starts with a cough that just won't go away, and feeling short of breath, especially when you're moving around. A doctor might notice something interesting, that it takes you a really long time to breathe out. You might hear some wheezing or crackling sounds in the lungs. And as it gets more serious, you can actually see people using the muscles in their neck and shoulders straining just to get a breath.
But there's one physical sign, a classic one, that really stands out over time. It's called a barrel chest.
Remember that whole air trapping thing we mentioned? Well, imagine your lungs are always partially full of old air. They're constantly overinflated. Over many years, that constant pressure actually starts to push the rib cage outwards, and that's what creates this rounded, barrel-like shape. It's a physical sign you can actually see, a direct result of what's happening inside. The disease doesn't just stay the same, it progresses. In the early stages, you might have long periods where you feel okay, with just a few flare-ups here and there. But as oxygen levels start to drop, the body goes into overdrive trying to compensate. It makes more red blood cells, which can actually give the skin a reddish or ruddy look. Later on, just the act of breathing burns an incredible amount of calories, so people often lose a lot of weight. You can get these dangerous air blisters on the lungs, and eventually, all that strain can take a toll on the heart, even leading to heart failure.
Okay, I know that all sounds pretty intense, and it is, but this is not a story that ends there.
There's a lot of hope, and there's a very clear path forward for managing COPD and really improving a person's quality of life.
So, step 1. The absolute, without a doubt, most important thing you can do is stop smoking. It is the single best way to slow this disease down, period, even if it's already advanced. After that, we've got medications, things like bronchodilators that help open up the airways. For people whose oxygen levels are consistently low, oxygen therapy is a game changer. And finally, there's supportive care, simple stuff like getting your flu shot, staying hydrated, which is so important for preventing the infections that can cause those really bad flare-ups.
Now, for folks who are on oxygen, this is the target range right here, 88 to 92%. And you might think, why not 100%? Well, it's a really delicate balancing act. You obviously need enough oxygen for your organs, but for some people with COPD, giving them too much oxygen can actually trick their brain into slowing down their breathing. So, that 88 to 92% range is the sweet spot.
When it comes to meds, it's not just about what you do take, but also what you don't. So do use those bronchodilators to open the airways. Do use corticosteroids to fight inflammation during a flare-up. But here's the big one. Do not use cough suppressants. I know it sounds counterintuitive, but for someone with COPD, that cough is a good thing. It's their body's way of clearing out all that mucus. If you suppress it, you're trapping all that gunk inside, and that can be really dangerous.
But managing this isn't just about popping pills. It's so much bigger than that. It's about creating a whole plan for living the best, fullest life you can.
And that's where all these other tools come into play. You've got pulmonary rehab programs to build up strength and endurance. A dietitian can be a huge help with the weight management side of things. And it is so important to keep an eye out for depression, because dealing with any long-term illness is tough mentally. And finally, planning ahead. Things like advance directives, that gives people the power to stay in control of their own healthcare journey.
And check this out. This is just awesome. To show you how creative these rehab programs can be, some of them have harmonica clubs. A harmonica club. And you might be wondering why. Well, it turns out that playing the harmonica forces you to breathe in a very specific way that's almost identical to a technique called pursed lip breathing that doctors teach. It's a fantastic workout for the diaphragm, and maybe even more important, it's fun. It builds community and brings a little joy into the whole process.
And for some people with really severe cases, there are even more advanced options out there. We're talking about things like special surgeries to remove the most damaged parts of the lungs, or even these tiny little one-way valves that can be placed in the airways to help the healthier parts of the lung work better.
Look, at the end of the day, managing COPD is a marathon. It's not a sprint. A diagnosis isn't an endpoint. It's a starting point for taking control. So whether this is something you're dealing with yourself or it's about someone you care about, I want to leave you with this question. What's just one small step? Maybe it's a conversation. Maybe it's a decision. What's one thing you can do today to help make breathing just a little bit easier tomorrow?